Hi, I'm Dr. J. Sordian, and I'd like to talk to you a little bit about IBS, which is Irritable Bowel Syndrome. I'm going to go through some slides here, and we're going to talk about Irritable Bowel Syndrome from the standpoint of Chinese medicine and the way that it looks at it. Now, of course, as a functional medicine doctor, and with that training, I also have a lot of perspective on how it works with respect to Western medical physiology as well. I'm going to throw a few little bits of that in there as well. But this is primarily going to be focused on Oriental medical perspective. So I hope you enjoy this. I hope you learn a great deal from it. And be sure to call 510-849-1176. That's 510-849-1176 in order to set up an appointment so we can find out exactly what's going on in your particular circumstance. Now, we'll not only use the traditional Chinese medicine approaches to determining what disharmony may be going on, but we also may need to do a variety of other functional medicine tests, laboratory testing, to figure out exactly whether there may be parasites, whether there may be other kinds of bacterial or fungal infections going on, or whether there's allergies going on with respect to your food. Now, we mentioned that some during this presentation as well, but these are special tests that we do that will help to determine and specify specifically what kind of biological terrain imbalances may be going on as well. So I hope you enjoy this presentation, and we'll talk to you soon when you call for an appointment. So let's talk about how acupuncture can help you with your IBS naturally. IBS is the most common digestive condition in the US. And digestive disorders are actually the #1 reason for employee absenteeism among female workers. And over 60 million people have IBS. IBS affects 1 in 5 adults. 10 to 20% of Americans have IBS, and 3 times as many women are affected than men with IBS. What is IBS? Well, IBS stands for Irritable Bowel Syndrome. The precise cause of IBS is not known, but we do know that it is an inflammatory intestinal disorder affecting intestines' ability to move the contents. It creates uncoordinated and irregular intestinal contractions, and that in turn can cause a buildup of toxins in the body. The nerves and the muscles in your bowel are very sensitive, and so any kind of emotional or other dietary upset can affect the upper and the lower gastrointestinal system. Those symptoms typically occur while you're awake, and it is a functional disorder, not a disease. Now, IBS is a syndrome, and so it is a collection of symptoms, sorry. So, for example, we may find bloating, diarrhea. No, IBS-D is the IBS with diarrhea, abdominal pain and cramping, constipation. Or people call this IBS-C for IBS type C for constipation. You may have mucus in your stools, might have nausea, could experience gas, as well as belching. Now, what could cause these symptoms to occur? Well, there's a variety of things that trigger IBS. It can be your diet, what you're eating, particular foods you're sensitive to or you eat too often. Could be drugs or medications can cause this. Hormones and hormone imbalances are related to IBS, or could be. There are various food intolerances or sensitivities. For example, some people are very sensitive to dairy or citrus, or they may be sensitive to gluten. There are also emotional factors such as stress, anxiety, and depression that are related to this as well. Now, how is IBS diagnosed from a Western standpoint? Well, doctors group together symptoms into what is called the general IBS diagnosis, which is why it's a syndrome. Now, you also might have medical tests done to rule out other health concerns because there's no specific diagnostic test for IBS. So one might get a lower gastrointestinal series, the lower GI series, maybe a colonoscopy, and blood tests as well. Because of the similarities between various symptoms of different kinds of diseases, IBS could also be mistaken for Crohn's disease, diverticulitis, lactose intolerance, that's an intolerance of milk sugar, could be mistaken for ulcerative colitis, and it can be also mistaken for some forms of cancers. So various tests can rule out these other health concerns before a diagnosis of IBS is made. How is IBS treated from the Western standpoint? Well, medication, over-the-counter medications are a typical approach, as well as are medical doctor prescribed drugs. Stress relief is also recommended, as are dietary changes in general. Now, according to traditional Chinese medicine, IBS has to be treated in a holistic approach. So it's very important to assess the entire constitution of the person. This includes physical and emotional issues. The focus is to bring your body back into balance so that it is functioning properly. And because it's not functioning properly, obviously, because you're having these symptoms, it's very important to evaluate and diagnose what the patterns of disharmony are. And then once we decide what that pattern of disharmony is from the Chinese medicine perspective, then there's a treatment that's developed based upon that particular pattern of disharmony. So how do we do this? How do we find this? How do we solve this puzzle? Well, we have to look at a variety of diagnostic methods, including pulse diagnosis, tongue diagnosis, abdominal palpation, palpating different areas of the abdomen to feel for tightness, tension, temperature difference, sweat, and doing a comprehensive intake, which is asking questions about your history, what's going on in your life, etc. Then we determine the likely cause or causes and develop an appropriate treatment plan. There are six main patterns of disharmony we will talk about. The first is spleen qi deficiency. Qi is energy in Chinese medicine, and this is the digestive energy referred to as spleen qi. So here is deficient. So symptoms include fatigue, which is worse with exerting oneself, diarrhea, abdominal pain that's relieved and alleviated with pressure, gas, bloating, and hemorrhoids. The treatment principle is to nourish the spleen and strengthen the body. And the herbal choice would be Buzhong Ichi Tong. Now, if we don't have enough energy to digest our food, then we're going to be tired. And just like if you're cooking food on a stove, if you don't cook the food long enough, then it won't be broken down, it won't be soft enough to digest easily. Well, that's the same thing that happens with if we don't have enough spleen qi. The food does not get cooked, the enzymes do not work properly, and we don't get digestion of food properly. And so diarrhea occurs with lots of undigested food. Second pattern is spleen dampness. Once again, we have fatigue, which is worse with exertion. Diarrhea, abdominal pain, alleviated with pressure, as mentioned before, and gas and bloating. But here we also have hemorrhoids, nausea, heaviness in the body and head, mucus in stools, incomplete bowel movements. The symptoms are also worse with fried and fatty foods and emotions. The treatment principle is nourish the spleen and resolve dampness. Herbal formula is Shenling by Jusan. Now, we have lots of fluids in our body, and when the fluids are circulated properly and removed properly from the body, we don't have accumulation of fluids like edema in the feet or other areas of the body. However, if the spleen is not working properly, then we will tend to accumulate these extra fluids, and that is what dampness is. So here we have an insufficient functioning of the digestive system, thus creating an accumulation of fluid in the body. So part of the approach here is to resolve the dampness, whereas in the spleen qi deficiency, that's a slightly less severe dysfunction where there is not quite the same problem of extra fluid. Next line here, we have the excess cold in the spleen. And symptoms include severe cramping pain, inability to tolerate pressure on the abdomen, which is the opposite of the previous two, and constipation. Our treatment principle is warming the spleen because it is cold and resolving the dampness that also occurs. Herbal formula could be Da Jiang Zhong Tong. The fourth pattern, typically associated with IBS, is spleen and kidney yang deficiency. Now, yang is the principle of heat in the body, and also it is energy and a lot of activity. So when there's not enough yang, the person feels cold. They have cold hands and feet. They have what's called cock's-crow diarrhea, which is diarrhea in the early morning when roosters crow. They have undigested food in their bowel movements and low back pain, which can be chronic because this usually takes a while for this to develop, and frequent urination. Treatment principle then, given that spleen and kidney yang deficiency, is build the spleen and kidney yang. And herbal formula might be Su Shen Wang. The fifth pattern is spleen and liver disharmony. Obviously, the liver is part of the digestive system in that it produces bile salts that go into the gallbladder and then are released as food goes into the upper part of the small intestine, the duodenum. And so the liver is part of the digestive process. So what kind of symptoms could a person have with this spleen and liver disharmony? Well, irritability is a common indication. Abdominal distension, abdominal pain, alternating diarrhea, and constipation. In this situation, the symptoms are worse with stress, anger, and frustration. Treatment principle, again, soothing the liver and nourishing the spleen, and the herbs combinations may be things such as Xiao Yao Wan or Tong Xie Yao Fang. The sixth pattern of disharmony is large intestine damp heat. This is characterized by abdominal pain, diarrhea with a sense of urgency. It's explosive, it's yellow, has very strong odor. There's a burning sensation at the anus. There's heaviness in the body and limbs and fullness in the chest. This situation is worse with stress, anger, and frustration. Now, before we talked about dampness, well, damp heat is a situation where there's a lot of extra fluids, but it's also very inflamed. And so the treatment principle here is clearing heat and eliminating the dampness. The herbal formula might be Gagen, Huang Jing Huang Lian Tong. And again, Tong at the end means a herbal decoction. So the question here is, you're probably wondering to yourself right now, which pattern of disharmony do you think you actually may have yourself? Well, without doing a comprehensive evaluation, it'd be very hard for us to say. Now, there are a number of research studies here that show that acupuncture, herbs, and other modalities are helpful for IBS. There was an Australian study published in the Journal of the American Medical Association that is also called JAMA. It suggested that Chinese herbs are extremely effective in treating IBS. Now, the patients taking the specific Chinese herbal formula showed significant improvement compared to patients in control groups. On the other hand, it said that this approach is most effective when each patient is correctly diagnosed with their particular pattern of disharmony. Just as we've been talking about previously, there are 6 major patterns of disharmony, and it's also very important that the person be treated for their individual conditions as well as their bodily constitution and other presenting symptoms. So the combination of both herbs and acupuncture were effective when the specific treatments are customized for each patient versus just a shotgun blanket. There's a study published in the Gastroenterology Nursing Journal that also said that acupuncture and the use of moxibustion can have a significant effect on symptoms associated with IBS. Now, moxibustion is the burning of a particular kind of herb, Artemisia vulgaris, upon certain points to help warm up and to medicinally affect the acupuncture meridian in that particular area. And it suggests that this may be helpful for managing the symptoms. Certainly something that I have found in my clinical practice as well. Then there was a review of various kinds of research that had been done regarding irritable bowel syndrome that was gathered from Medline and MBase. And the Cochrane database of systematic reviews. Now, this search was done up until March of 2018 and include a wide variety of different kinds of therapies. You can see the long list in the first paragraph. And so there were a variety of different things that the research concluded, such as soluble fiber improves constipation and global IBS symptoms. Peppermint oil alleviates IBS symptoms, including abdominal pain. It noted that probiotic trials show overall benefit for IBS, and they claim that there is little evidence supporting the use of any specific strain. However, that has not been my clinical experience, because particular strains are more resistant to the effects of stomach acid and bile salts in the intestinal tract. Now, when we eat food, obviously there could be some bacteria and other things on it, and one of the purposes of the hydrochloric acid in your stomach is to kill those bacteria. So any bacteria going in through the stomach and upper part of the small intestine, there are various ways our body tries to protect us from bad bacteria or fungus and other things getting into our system because it can create havoc. They can. So there are certain strains of good bacteria that actually are more effectively able to penetrate that barrier. So I would disagree with the findings of this particular review of research, although I don't know the specifics of what types or strains they actually looked at. They also noted that hypnotherapy and cognitive behavioral therapy are also effective therapeutic options for appropriate patients. And again, I have found, and I've used hypnotherapy along with acupuncture for decades with people, and found that to be very helpful in calming the nervous system, the autonomic nervous system, over reactivity that occurs with the sympathetic nervous system when we're under stress a lot of the time. So here again, this is showing the overall, the review concluded that several complementary and alternative therapies can be recommended as a part of evidence-based approach to treatment of IBS. Now, evidence-based is the new standard for most care, which is based on empirical. It's observation to see what works. So an additional study looked to see if acupuncture combined with massage was beneficial for people suffering from IBS. And it concluded that the combination of the two should be jointly used in clinical treatment. And certainly that is the case if the abdominal palpation reveals that there is tightness and tension in the abdominal wall. I often prescribe self-massage for individuals, self-abdominal massage, to help improve the normalization of the peristaltic motion in the intestinal tract. So what about diet? Well, we know that diet can have a significant impact on the digestive system and irritable bowel syndrome. So typical foods that we might have someone avoid are dairy products. Another one is wheat products, particularly because of the gluten sensitivity factor that so many people have now. And the gluten can also influence the brain. It's interesting to note, as a side note, that there is the gut-brain connection. And if the gut is out of whack, the brain will also be influenced. And this is one of the contributing factors to the degenerative changes in the function of the brain we note with dementia. Okay, caffeine and alcohol are things to avoid. Caffeine increases the contraction of the intestinal tract. Gum and soda that contain sorbitol, artificial sweetener. Nuts and chocolate may be things you need to avoid. Fatty, fried, and spicy foods. Cold foods, again, we talked about cold in the body. If foods are too cold, then the body has to actually heat them up. It has to use its own energy to heat up the contents of the stomach and large intestine in order for enzymes to break down the nutrients. And enzymes have a particular optimal range of both temperature and pH, which is the acidity, where they work. And so if those are thrown off, the digestion will not occur properly and inflammation can result. And carbonated drinks are also recommended to be avoided. So what are some foods that we would like to add to the diet? Well, potato broth. Although if someone is sensitive to the nightshade family, such as tomatoes, potatoes, and eggplant, then potato broth should be avoided as well. Miso soup, steamed and mashed parsnips, squash and pumpkin, papaya, grated apples and bananas, congee, which is a rice porridge. And here also the parsnips, squash, pumpkin. A lot of these things contain a good amount of fiber that's healthy for the intestine. Many people have a low fiber diet in what's called the standard American diet, which is made with a lot of processed foods. So often, not getting enough fiber in the diet will have a deleterious effect on the intestinal health. And then we also find the foods that we need high in omega-3 fatty acids, such as vegetable and nut oils, cold water fish oils, evening primrose oil, and borage oil are all good sources of good fatty acids. And water-soluble fibers are important, such as psyllium seed, barley, rye, wheat bran, and legumes. Once again, fiber being an important component of diet. So if you're preparing to go into your doctor, it's important to be able to tell your doctor exactly what is going on. So pay attention to your body and what you're putting in your body, both physically and emotionally, and write these things down and keep a food journal. So figure out what kind of things you think is triggering this response in your intestine. So what are the symptoms you have? When did the symptoms occur? It could be bloating, it could be pain, irritability. What was it that you ate? Was there something that you ate that caused that to happen fairly quickly thereafter? And what foods always make you sick? So keep track of these things, and that will be very helpful to help you and your doctor solve this puzzle for you. There are also certain healthy habits that one should have. You may need to make lifestyle changes, changing the foods that you eat. Stress management may be an important part of what you need to do, and exercises such as Qigong and Tai Chi are very excellent ways to help reduce stress responses, not only mentally, not only emotionally, but it actually makes a physical change in your body. Abdominal massage, very good thing to do, and I show patients this when appropriate. Intestinal flora, these are the good bacteria, the probiotics. Certain strains of Acidophilus bifidus, as well as others, are very important for the health of the intestinal tract. And again, just getting any old thing from the store or from the internet is not necessarily going to help you the best. And sleeping sufficiently is very important. We need our sleep to reset the brain, to reset the body, to give it a chance to rest. And this adequate sleep and adequate rest can relieve stress and help the body heal. So it's important to note also that acupuncture, in addition to helping the intestinal tract and improving the function of that, it can help you return to a more normal life and be able to have more normal activities where you aren't stressed out, where you aren't dominated and controlled by your IBS symptoms. How long does this take? Well, typical treatments can last several months, and including acupuncture as part of your normal health routine is a very wise idea. The other treatments that we would be using could include herbal formulas such as the ones mentioned previously, acupuncture, acupressure, oriental food consultations, and also functional medicine approaches. Now, most acupuncturists are not trained in functional medicine, but I am, and so that is something that I bring to the table as an additional benefit for your coming to see me at the Redwood Clinic. In conclusion, if you are suffering from the debilitating symptoms of irritable bowel syndrome, call us. Try acupuncture. 2,500 years of medical history can't be wrong. So give us a call. Thank you for watching this presentation. We hope you learned a lot from it. We hope you will get some relief from what you learned. And to set up your appointment, please call us at 510-849-1176 and visit www.theredwoodclinic.com. Best of health to you, and I urge you to take the natural path to optimal